Welcome to our Wellness Wednesday Health Show. I'm your host, Dr. Kali Hewlett from the Back Pain and Sciatica Center of Texas, where we offer regenerative pain solutions. And the purpose of this show is to introduce you to different health-oriented businesses in the community that can help benefit you. And so I'm excited to be on location with Desi from First Response Family Clinic. First, if I can say that, First Response Family Clinic.
There you go.
Desi, welcome to our show today.
Thank you so much for having me.
So Desi, tell us, how did you first get into healthcare?
Oof. A long time ago when I was 18, I developed a headache, was heading to downtown for an interview, and I had a blackout episode. Fast forward, I developed a subarachnoid bleed, ended up in ICU, received phenomenal care at Memorial Home in the Woodlands. I was a firefighter at the time, married to a fireman from the Woodlands, and received really, really good care. I was in ICU for a month, and I decided to pay it forward because of the care that I received. Became a nurse, after which I got very frustrated with the healthcare.
What was one of the big frustrations in healthcare that you experienced? Okay.
Insurance and Prescani. Everything was driven by insurance reimbursement, and it was just, to me, being a nurse was more frustrating because of the it seemed to be money driven, and the bedside care got lost. I became a nurse practitioner and decided to open up my own clinic, really to help and to really give back. I have 4 children. We've been blessed. We're now empty nesters, so now it's time to give back. Open up a clinic, try to take care of the community, and just take care of them and give back.
So that's where the first response comes in. As a first responder, it's in your blood, as between yourself, your husband, and then eventually going through the nursing and the nurse practitioner.
That is correct.
So how long has First Response Family Clinic been open?
We opened September 11th, very intentional, of last year. So we just completed a year, and we're growing. We're growing exponentially. Unfortunately, COVID was a benefit to our clinic, because we were one of the first clinics in the area that we offered the rapid test.
Okay.
And so that really put our name out on out in public to let them know that we were here. The biggest challenge that we're facing now is that we are not just a COVID test. We originally set up to be a primary healthcare, for really for the uninsured or the insured, because our prices are so reasonable.
As a nurse practitioner, and many people may or may not know this, but you're actually trained to be a primary care provider.
That is correct.
Right?
That is correct.
And so, in a lot of states, including Texas, you are like the primary care provider. As more doctors move into specialties and whether it's cardiac specialty or oncologist specialty, there is a void that was needed in primary care, and nurse practitioners, I believe that's your role, is like, hey, we are the primary care providers.
That is correct, and we by no means do we want to take the place of a doctor, but just work alongside with them and really to unburden the emergency room. Oh my gosh, when I worked in the emergency room, it was nothing but, it was congested because a lot of patients would come there for primary care purposes, but they would clog up the emergency rooms for people that truly needed them. So we're not here really to replace doctors, but to work alongside with them and really to help, the throughput of our medical system.
So in a place like this, First Response Family Clinic, it really is a family primary care type clinic that you've established here.
Yes, it is.
We see a growing number of patients in our clinic, and I think just in the community overall, that don't have insurance anymore, or that have insurance where it's just a goofy, crazy plan where I call it the break the bank, where it's going to cover, hey, if I need a heart transplant or major surgery, that's what the insurance is for. But for family care, cough, cold, or other type of things that would be non-life threatening, they have minimal to no coverage for that.
That's correct.
For those type of people that fall under the no insurance or the unique policies where it's the break the bank, what are some of the services that you say, hey, we want to help with you in these areas?
We offer anything from well woman visits to male hormone treatments. We do upper respiratory infections, urinary tract infections. We do DOT testing. We do back to school physicals. We do immunizations. We do IV therapy, hydration. You name it, basically we do it. We do skin tag removals, we do massages, anything that we are not able to do. We have partnered up with you as well. It's like back pain. Back pain is such a common complaint, that we can only do so much. I can only give so much Toradol, steroid shots, but then, we'd like to refer back to you to say, hey, help us out with this patient. This is what they're presenting, and collaborating with different people just to kind of help, in getting people back into feeling good.
Now, I'll ask you the stitches.
Mm-hmm.
Okay, as well.
Yeah.
Okay.
Yeah.
Just because I have 4 kids and we've had a few stitches in the house.
Yep. Yeah.
What
Suture stitches.
Okay. What are your hours here?
Monday through Friday, 8 to 5, and hopefully we're going to be opening up Saturday.
Okay.
So yeah, we're slowly growing, expanding our team, expanding our services and our hours.
Okay. I think that's great. What would be the benefit to coming here? Because some of the patients I know, they don't feel well, and they're like, I don't have insurance, I gotta go to the ER.
Mm-hmm.
Or they pull up online and try to find like an urgent care facility. What would be the benefit, would you say, to coming to a place like this as opposed to going to the ER or one of these urgent care facilities for a need that may arise?
Number one, local. We're local to wherever. If my background is in EMS, so I have a lot of emergency training as well. So if I see that somebody needs a little bit higher care, I'm able to help them make a determination of, this is more than just primary care. You need to go to the hospital. I've called 911 before, with people that do present with an acute illness that need emergency transport. Time, you come in and out, there's no wait. You can come in, there's myself, I have 2 other nurse practitioners that work alongside with me. We have a team of medical assistants, so it's like we're able to get people seen in and out in less than 20 minutes, and you just can't beat that.
Appointments ideal, but if needed, can they just...
Both. We do. We are really here for the community. If you want to walk in, we'll see you walk in. There's really very little wait. If you want an appointment because you want to be seen at a specific time, we can do that as well.
One thing that I loved, and we were talking a little bit before we started rolling the camera, was, your background as a firefighter, your husband a firefighter. He's been there, I think you said 30 plus years?
40. He's
40.
retiring.
Okay, 40 years.
Yeah.
I love people that live in the community and that provide care here. I think there's a difference when you're going to see your patients at the grocery store, at the gas station. It's, for us, we enjoy seeing the patients because it's a high five, it's a how you doing, because we enjoy building win-win relationships with our patients. Yeah. And I get that same feeling for you. It's like, and you mentioned kind of the bad taste that when you were nursing, and it was like so much of, you got to do this test, you got to do this test because we got to get this reimbursed.
Yeah.
It kind of took the care out of healthcare.
Yes.
And took the passion out of it. But now being able to have your own facility seems like you're reinvigorated. Now it's your way of delivering true health care, caring for the patient.
Yep.
So I just think that's really cool.
Our logo is, or our motto is, you come in as a patient, but you leave as family, and it's truly truth. People will see us at Pizza Shack and hey, Dr. Bittner, and it's like, well, I'm not a doctor, but hello, and they very much appreciate not only me but my staff. So yeah, we feel very welcomed here, and I'm happy that I'm able to help the community.
And easy to find, right? I know for a while you had the antique. I think when I was talking to your husband before, you have a couple antique fire trucks.
We do.
Right?
We do.
And you had an antique fire truck parked out when you first opened. I just thought that was the coolest thing. It's like the little boy when he comes out and sees a fire truck. Anyway, so I know at times you have it parked out.
Yep.
Not all the time.
Yeah.
But where are you located for those that are watching or listening today?
We are, our landmarks are, you're going to come right across from Conroe High School, across from BBVA Bank. We're really easy to find. We're at 3401 West Davis in the Park Place Center. And we are going to have the fire trucks in the Conroe Parade and the Montgomery Parade, both decorated out, giving out hats or different things for the kids. And
do you drive those as well?
I do.
Okay.
I do. Yeah, I'm going to drive the big fire truck, and my husband has antique that's a standard, so he can do that one. It's a little bit of a challenge.
As a side note, there is part of the Lions Club here in Conroe, and a couple years ago, one of the fundraisers, you could sign up and to be fire chief for the day. So I was like, oh, that'd be perfect for my 2 boys.
Yeah.
So, you know, we won the donation
Mm-hmm.
and I went to the fire station, and it was really cool just be able to play on the fire trucks and shoot the water hose. They let us do a lot of cool things there.
Yeah.
So again, I just
We've done gender reveals with the fire truck, you know, because it has our clinic name. So if you have a boy, you know, we'll put blue food dye in the water, and then, you know, okay, ready, and then blue, you know, water comes out if it's a girl. You know, birthdays, we did a birthday for an 80-year-old patient, and she just loved it.
see
you know,
something about fire trucks, and
Yeah.
it brings the kid knowledge.
it really does.
Now, if someone's in their car listening right now, what is the phone number here if they want to reach out to you? What is the phone number?
936-231-8610.
Okay. And do you have a website as well?
We do. www.frfclinic.com.
FRF. And what we'll do is, if you're watching this, we're going to make sure we can put a link above and below. That way you can just click and find them. And for those of you who've been to our office and our patients, they're actually in the same strip center as us. So we share actual walkways, easy to find. And we're excited to have you as neighbors. It was
Thank
just,
you.
what were we talking, 2, maybe 3 months ago you moved
Yep.
in here?
Yep. 2 months.
2 months.
Yeah.
You did a great job of moving in and beautifying the place. So
Thank you.
we're excited to have you as neighbors here.
I'd love to be here.
Any last words of wisdom or health advice for our audience today?
Stay safe. You know, we're here for you guys. Do the rapid test. Obviously, social distancing, doing everything. Hopefully, we'll have a vaccine and get back to normal, whatever normal is.
Okay.
You know.
Awesome. Thank you, Desi.
Thank you so much for having me.
Thank you guys for tuning in, and we'll see you next week.